5 signs and symptoms of low thyroid, hypothyroidism. Low thyroid, also known as hypothyroidism, is a medical condition characterized by an underactive thyroid gland. The thyroid gland is responsible for producing and releasing the hormones that control many aspects of our bodily functions, such as metabolism and heart rate. When the thyroid gland isn't functioning properly, it can have a number of negative effects on overall health. Common symptoms of low thyroid include fatigue, weight gain, sensitivity to cold temperatures, and depression. Symptoms of low thyroid can vary widely depending on the individual and the severity of the condition. Here are a few. 1. Fatigue. Fatigue is one of the most common symptoms associated with hypothyroidism, but it's more than just being tired. It can also include a lack of energy, feeling sluggish and lethargic, having difficulty focusing or concentrating on tasks at hand, slowed thinking or memory loss, a condition known as brain fog, getting easily frustrated, and being more irritable. 2. Depression or anxiety. Depression and anxiety are two of the most common mental health conditions, affecting millions of people every year. Although these conditions can have many causes, a large percentage of cases are often linked to thyroid disorder. If you're experiencing either depression or anxiety, it's important to get your thyroid levels tested. Low thyroid function can cause changes in the levels of certain hormones related to depression, including serotonin and dopamine. In addition to these hormonal changes, people with low thyroid may also experience brain fog, which can contribute to feelings of depression. 3. Dry skin and hair. Dry skin and hair can be a sign or symptom of hypothyroidism. Thyroid hormones help regulate many important physiological processes in the body, including growth and metabolism. When levels of these hormones are reduced, some common symptoms may develop, such as dry skin and hair. Other potential symptoms of hypothyroidism include weight gain, fatigue, and sensitivity to cold. Factors that may make dry skin and hair more likely in people with hypothyroidism include genetics, the lack of certain nutrients such as iron, vitamin A or iodine, your overall health status, and hormonal changes. 4. Muscle weakness. Muscular weakness is one of the most common signs and symptoms of low thyroid. This muscle weakness refers specifically to an inability to exert force from your muscles, so if you attempt to do even things like walking or climbing stairs, you may feel that your muscles are just too weak to do it. Studies have shown that people with hypothyroidism have difficulty using their leg muscles to walk and perform other activities such as standing up or climbing. You will also likely feel this weakness in your hands and arms, so that typing, writing, or other tasks requiring fine dexterity can become a challenge. If you notice any of these symptoms, it is important to get tested for hypothyroidism, because the symptom of muscle weakness can be caused by other medical conditions such as anemia and vitamin deficiency. 5. Constipation. Constipation is a very common problem and can be associated with low thyroid function. Constipation is more common in women than men, usually occurring between the ages of 30 to 50 years old. Constipation occurs when bowel movements become infrequent or difficult to pass, causing a feeling of abdominal bloating and discomfort. It is important that you not only understand the causes of constipation, but also the symptoms you should be looking for. There are many things that can lead to constipation from hypothyroidism. Here are some of the most common ones. A. Lack of exercise. One of the main causes of constipation in hypothyroidism is a lack of exercise. When you aren't getting the daily recommended amount, your body is more likely to move slower and waste can build up in the intestines. This can lead to constipation. Consistent exercise will help break down waste and keep your bowels moving regularly. B. Low hormones. Another big issue with low thyroid function is hormonal imbalance. When your body isn't producing enough of the hormone T3, it can cause a major impact on every system in the body, including digestion. The T3 hormone is responsible for stimulating peristalsis, or rhythmic movements in the intestines. When you're deficient in this hormone, the contractions of your intestines decrease, and this can lead to constipation. C. Dehydration. When you're not getting enough water, your body tends to retain more fluid, and this can cause an intestinal blockage, which leads to constipation. It is important to drink at least half your body weight in ounces of water each day, or more depending on how active you are. D. Low bile production. One cause of constipation can be low bile flow. This is because the liver produces bile, which is needed for proper digestion and elimination. When it's not being produced, the intestines can become congested, and this can lead to constipation. E. Lack of fiber. Not getting enough fiber in your diet is a major cause of constipation. Fiber is an important part of a healthy diet that helps keep your digestive system working properly. Without enough of it, you are more likely to have slow-moving bowels, and this can lead to constipation. If you are experiencing symptoms of low thyroid, It's important to speak with a healthcare professional immediately. Thank you. Don't forget to hit the subscribe and see more of our other interesting videos.